Hello everyone and welcome back to our channel. So in this particular video we shall discuss the MCQs on the chapter anti-anxiety drugs. Okay, some of the representative questions we shall take up on the anti-anxiety drugs which are used in the treatment of anxiety, which is the condition related to the CNS wherein the fear of a particular situation or a person or future concern mainly is produced. Okay, so the symptoms which may be included over here, that is the tremors, a palpitation, vasodilatation may be produced. Okay. So, flushing may be produced in this particular situation. Okay. Then coming to the first question, an example of BZD which is used as an anti-anxiety drug is, okay. So, BZDs, that is benzodiazepines, okay. It is utilized as a sedative hypnotic. It is also having the anticonvulsant property or anti-epileptic property, and it also has anti-anxiety property. Okay. So, these are some of the examples: Temazepam, clobazam, chlordiazepoxide or clonazepam. Okay. So, all of these are the examples of BZDs, but we have seen that BZDs, specific examples may have specific use. Okay. It may have a specific facet of action which is produced, a specific area in the brain may get affected. Okay. So, the example of BZD which is used as an anti-anxiety is the chlordiazepoxide. And the second question, Gepirone belongs to which of the following class? So, the name of the class, we have seen under the classifications that a particular type of drugs may be divided into several classes, right. So, the classes like say benzodiazepines is one of the class, azapirones, okay, beta blocker is one of the class, buspirone is actually an example belonging to the same class as Gepirone is. Okay, so, this is not the correct option. Okay. Gepirone is not a benzodiazepine, also it is not a beta blocker, it belongs to the class azapirones. From the suffix it is very clear that all of these, okay, have the same suffixes. Okay, so, you can clearly identify that it belongs to the azapirones. Third question, beta blockers, these are used to control the symptoms of anxiety due to sympathetic overactivity, serotonergic overactivity, dopaminergic overactivity or parasympathetic overactivity. So, the symptoms of anxiety like the palpitation, okay, increase in the heart rate or tremors, okay, all these may reinforce the anxiety. So, all these symptoms are produced actually due to the sympathetic overactivity. So, beta blockers, okay, so the name is very clear. Beta receptors belong to the sympathetic system, right. So, beta blockers are used to block the actions produced by the sympathetic overactivity. Okay. So, the correct answer is sympathetic overactivity. And the fourth question, hydroxyzine is an antimanic, antihistaminic, antipsychotic or antiadrenergic. Okay. So, hydroxyzine drug, it is one of the anti-anxiety drug. It belongs to the antihistaminic property because it blocks the histaminergic receptors. And the fifth question, properties of buspirone include. So, which of these are one of the properties of the buspirone or it is none of the above. Okay. So, the properties, the options are as follows: produces the tolerance of physical dependence, produces the significant sedation or cognitive functional impairment, cognitive or functional impairment, interact with the BZD receptors or none of the above. Okay. So, in the introduction to the buspirone we have seen that it does not produce any tolerance or physical dependence, neither it produces the sedation or any kind of cognitive or functional impairment. It is also not interacting with the BZD receptors. So, the correct answer is none of the above. Okay, so these are some of the representative questions for the anti-anxiety drugs. Thank you for watching.